Welcome to the Heart Talk, a podcast dedicated to empowering you with the knowledge and habits that keep your heart strong and healthy. In today's fast-paced world, where stress is high, lifestyles are sedentary, and processed foods often replace wholesome meals, heart disease has become one of the world's leading health concerns. And alarmingly, it's affecting younger people more than ever before. Hi, I'm Huma Qureshi, and in this episode, we're joined by a leading physician to help us understand how we can protect our hearts, detect early warning signs, and make choices that ensure a longer, healthier life. Together, we break down the science into simple, actionable steps that you can start today, because a healthier heart means a healthier you. So, doctor, tell me, why are so many people today, younger people, even celebrities, getting heart attacks at just 40? I mean, aren't heart problems for older people?
Wonderful question, Huma. Young people developing heart attacks is increasing mainly because of diabetes, obesity, smoking, and of course, stress. Studies have shown that Southeast Asians are at higher risk of heart attacks due to genetics and lifestyle factors. In fact, 25% of heart attacks in India occur in people who are under 40 years of age. People may look very fit from outside, but of course, they have hidden risk factors like high cholesterol or maybe even genetic predisposition.
So, what are the warning signs that I should never ignore when it comes to my heart? And when should I see a doctor?
Excellent question, Huma. Chest pain, pressure in the chest, shortness of breath, or fatigue without any reason may be the few symptoms, but majority of the times, sometimes they may have only pain radiating to the arms, to the jaw, or to the back. It can be palpitations or dizziness or fainting. Very early detection saves life. Delay in treatment increases morbidity and mortality very significantly.
And what are the most important daily habits that people can adopt to keep their heart healthy and to reduce the risk of heart disease? And what are the daily habits that people can use to keep their heart healthy and reduce the risk of heart disease?
Wonderful. Eating a balanced diet which is rich in fruits, vegetables, whole grains, and lean proteins is very, very important. Also, maintaining a healthy weight, monitoring blood pressure, blood sugars, and blood lipids at regular intervals, especially regular screenings after the age of 30 in high risk individuals, are very, very important. You have to quit smoking, reduce alcohol intake, and exercise is very important for at least 150 minutes per week for moderate activity, or if it is vigorous activity, for at least 75 minutes per week.
How much do diet and physical activity actually affect your heart health, and what are your top recommendations?
Wonderful question again, Huma. Up to 80% of premature heart disease is preventable with healthy diet and exercise. In fact, it is known that a Mediterranean diet or DASH diets, that is dietary advances to stop hypertension diets, they reduce the risk of cardiovascular events very significantly. Regular activity, mild to moderate exercise, improves blood pressure, cholesterol, and insulin sensitivity. In fact, what I would say, consistency and persistency is more important than intensity of exercise.
What about stress? Does stress actually affect the heart, and what are the practical steps that one can take to reduce it?
Chronic stress increases blood pressure, increases the risk of inflammation in the blood vessels, and of course, the risk of arrhythmias and stress related heart attack is very well documented among young professionals. What we have to do is practice meditation, yoga, deep breathing, mindful living, and of course, adequate night sleep is very, very important. And very important in these days of digital this thing and social media, people should disconnect, take disconnect from social media and help in mingling with normal human beings and have this thing. Also, if stress is more, then counseling will also help to reduce the stress burden.
Well, as we wrap up today's conversation, remember, your heart's health is in your hands. Every small change you make, from the food you eat, the way you move, and how you manage stress, adds up to a stronger, longer life. We hope the insights have inspired you to take those steps starting today. After all, your heart works for you 24/7. It deserves the same care and commitment from you. Thank you for tuning in. Until next time, keep your heart happy and it will keep you going strong.